In Flanders fields, the poppies blow. Between the crosses, row on row, that mark our place, and in the sky, the larks, still bravely singing, fly, scarce heard amid the guns below. We are the dead. Short days ago, we lived, felt dawn, saw sunset glow, loved and were loved, and now we lie in Flanders field. Take up our quarrel with the foe, to you from failing hands we throw. The torch be yours to hold it high. If you break faith with us who die, we shall not sleep, though poppies grow in Flanders field. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Teresa, will you call the roll?
Commissioner Matthew.
Here.
Commissioner Hoffmaster.
Here.
Commissioner Houts.
Here.
Commissioner Leininger.
Here.
Commissioner Baker. Commissioner Lanius.
Here. There are 5 members present. That would be a quorum. The agenda is before us. What is your pleasure on approving the agenda?
I make a motion we approve the agenda as presented.
Support. Motion by Commissioner Hoffmaster, support by Commissioner Lanius to approve the agenda as presented. Any discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Approval of the minutes of the April 27, 2023 Board of Health meeting.
Mr. Chairman, I make a motion to approve the minutes from the April 27, 2023.
There's support.
Support.
Motion by Commissioner Matthews, support by Commissioner Hoffmaster to approve the Board of Health minutes from April 27, 2023. Any further discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. It is that time on our agenda, and we will have another one at the conclusion of our business session today for the public to address the Board of Health. I would remind any public that wishes to address the Board of Health that our rules for your public comment are listed on our agenda, and the public is allowed 3 minutes to speak. Do we have any public that would wish to address the Board of Health this morning? Hearing none, we shall proceed forward with the health officer's report.
Good morning.
Good morning. Good morning.
So as you all know, the public health emergency ended on May 11th. We continue to offer some services for COVID, including immunizations. Testing, however, is coming to an end as far as the in-person testing that we have here at our office. You noticed today, as you arrived, probably the cone's set up. This is the last month that they will be here, so today being the last day. We are working with our local libraries to encourage them to participate in the library program that the state of Michigan has established. That allows individuals to visit their local library and obtain free test kits. They're over-the-counter test kits that they can take home and administer on their own as they need to. We do already have some libraries that have been participating in the program, but we've reached out to additional libraries to encourage their participation. So that's going on. Our kiosks that we have in 4 locations around the county, Branch and St. Joseph, we never got one in Hillsdale. We don't know yet, even though I've continued to reach out, the full status of whether or not those kiosks are going to remain supported or if they're going to be loaded up on a semi-truck and taken away. And, you know, we're getting at the point where by tomorrow or by Tuesday next week, I should have an answer. We're hoping that they'll stay and they'll be supported, but we of course do not know. We will no longer allow individuals the opportunity to schedule a vaccine appointment online for COVID. They'll need to call our office, talk to our immunization staff, just as they do for any other immunization appointment that they make. So that is also happening. And we do continue to investigate confirmed cases of COVID, just as we investigate all communicable diseases that are notified to our agency of residents that live in the Tri-County area. So other communicable diseases that we routinely investigate are Salmonella, Shigella, tuberculosis, sexually transmitted infections. So this is normal work that we do all the time. COVID simply put us in a position where we had pandemic illness, and it occupied pretty much every moment of our life for 3 years. But as we return to normal business, we will continue to investigate COVID cases just like we do every other communicable disease. So public health accreditation, last time you were here, we talked about how that was happening here at the health department. That wrapped up on April 28th, so you were here during accreditation week. The reports from the reviewers are not yet ready. They should be any moment now in the kiosk for us to review. And of course, we will share that information with the board. I would expect that to be at the next meeting then, as far as those reports go. This was a different accreditation review than what we are accustomed to. The determination was made not to give METs, not METs, and MET with conditions, but instead to use this opportunity to work with public health staff, ensure that they understand the requirements of their program, and then see if they need any technical assistance, and that technical assistance then will be provided. So that wrapped up. Strategic planning activities continue to move along. I have now met for the first time with our employee satisfaction work group. They selected a chair and a secretary and have set up a meeting schedule, and I will continue to meet with that group to work on those issues regarding employee satisfaction. The Personnel Policy Committee, as outlined in our personnel policies, has continued to meet to modify and update several of the agency's work policies. We completed the exposure control plan, chemical hygiene plan, and in final draft is our medical waste plan. So once we have those 3 wrapped up, we will continue to look at other documents that our personnel policy can assist us in updating and making correct. The documents, once they are complete, will be stored in our performance management software that we call BMSG. You've heard us talk about that before. That helps us to ensure that they receive an annual review and are kept up to date. After the meeting today, Teresa will be providing an educational piece on public health finance. So as soon as the board meeting ends, she will get started with that, and I hope you can all stick around for that presentation. The website, we've received, feedback from you as well as the public that there is improvements that we can make to our website to make it more usable for our communities, and so we are in the process of doing that right now, and may even by next meeting be able to show you an updated website. Our EH software implementation, and Paul may talk about this a little bit today, is really moving right along. We're making great progress with this new vendor, Hetero, and I'm really excited to see this moving along. Our vector-borne surveillance program, again, Paul may touch on this today, has started. Some of the contract workers are in. These are usually college students who have time over the summer to do this type of work. They've been doing mostly tick drags, I think, at this point. We'll be doing some mosquito collecting very soon. So with regards to agency meetings and trainings, we continue to make progress with getting our staff trained in the National Incident Management System courses, the ICS courses. You guys may have taken those as county commissioners or have been asked to do so from your emergency manager. Anyway, we're having all of our staff take a certain number of those courses so they have an understanding of how that system works, so that when we do respond to emergencies, they have some idea what their roles are and how to respond. We also had an agency all-staff meeting on Friday, April 21st, which was a great success. And then our Health Education and Promotion Department is working on providing a wellness activity for our staff. And so that will be happening sometime this summer. And then in June, we'll be having quarterly staff meetings with our teams again in each office. We'll do that quarterly, where we move around and go to each office. You guys are certainly welcome, and I'll share with you those dates when they're occurring. Our needs assessment is complete, and the CHIP is in its very final draft at this point. We'll be ready to present that to you in June. I don't have really any update on the opioid settlement funds. I did reach out to, as you had mentioned, Commissioner Leininger to Commissioner Benzing, and he pointed me in the direction of Commissioner Wiley because of the committee that had been established. So, but I do need to continue to follow up with St. Joseph and Branch County. It's not hearing anything there yet. Our annual report is in your packet today. We're looking for acceptance of that so that we can share it out with our communities. Medicaid redeterminations is a project we're working on here at the Health Department, trying to support and encourage those individuals who currently receive Medicaid to update their contact information on their state site to make sure that when they get the letter that it's time for their redetermination, that they actually get it, and then encouraging them to open their mail and respond to that letter. If they don't, they will be dropped, and hopefully most of those folks will get their mail and respond appropriately. There are individuals probably that no longer qualify, which is part of the reason we're doing redeterminations during the public health emergency. That was paused. So MDHHS is now going back and they're doing every redetermination, so it's a huge mountain of work for them. It will take them a year to get through everyone. But we will see individuals that had Medicaid drop off and may be of concern to individuals who lose coverage and need to look at, if they can afford something on the marketplace or other options so they have some type of medical care coverage. Okay, Coldwater. We continue to work with Branch County Maintenance Team to remodel and improve this building. They've been working a lot on the exterior, removing very overgrown bushes. They're going to be taking some of the stones out and seeding up to the edge of the building. We think it looks tons better. I hope you guys think it does too. And we will be working hopefully on the inside of the building soon. Our Hillsdale office contractor on the parking lot, we don't have a date yet.
No.
But that, of course, as you know, that contract's been awarded and that parking lot replacement will occur this summer. The contractor who's doing the outside of the building in Three Rivers will be doing that project in June, starting end of June. So he's notified me that the materials have been ordered. He's requested the half payment so that piece of it can be covered. And then we'll get started at the end of June. So, and the additional space that is being completed over in Sturgis is in progress, not yet done. And I think that's what I have for you today.
Does anybody have any questions for the health officer? Yes.
How well does Paul like the new Hedgerow software?
I'll let him say how he likes it.
Oh, yeah, it's great. We are so pleased with the progress in such a short period of time that we've been making with them, and actually Justin over here is kind of he's one of our IT people. He's kind of leading the charge, and he's done a really good job in communicating with their folks and getting the uploads done. from the historical data. We were anticipating we might have more problems than we've actually had. So that's been moving along at a pace that we're really, really pleased with. And Justin, if you want to add anything to that, be welcome to.
It's okay.
So at this point, you feel it's a good move?
Absolutely, absolutely.
Okay.
Yeah, and we have several of the EH staff involved with the process as well, and they're so pleased because the same people, pretty much the same people that were involved with our last program, and they were so discouraged with how that was going and how slow things were and how unorganized they were. Everybody's super impressed with how professional this company is and how quickly we're moving forward with getting things going. So yeah, I couldn't be happier.
Good. One
We
more thing.
appreciate the investment. Thank you.
One more thing, on the Medicare or Medicaid redeterminations, does that affect people on Social Security or no?
Only if they have Medicaid, I would guess. So if an individual has Medicare as well as Medicaid, their redetermination would happen, I would assume, just as everyone else does.
Okay,
So,
so there
Correct.
won't be any separation between.
I don't think there is any.
No, I mean, Medicaid redetermination generally is done on an annual basis. It had been paused during the health emergency. Now it's coming back in, and yet, a lot of the things, those individuals that are on Medicare and Medicaid, a lot of their redetermination is done automatically through the IRS and through the Social Security Administration in that. One of the key benefits that they get by being on Medicaid is their Part A premium is paid by Medicaid, and they don't have to pay for that out of their other Social Security.
Okay.
You know that so much better than I do.
That's all I got.
Commissioner Hoffman.
Becky, with you saying, so the public health emergency ended on May 11th. So are we from a health agency standpoint kind of back to normal business pre-pandemic?
For the most part, we still have a couple of contracted staff that are working on COVID case investigation, and one individual who actually works here with us all the time, who also is dedicated to work on COVID case investigation and COVID support. Those grants run through, we have some time left on some of those grants. So, COVID's not gone.
Yeah.
We still need to be thinking about it in some respect, and so we'll keep those staff on as long as grant funds continue to support them.
From a leadership standpoint, I know we are, on the ground level,
Yeah.
but is there a way that you can, or your staff can, do kind of an after-action report? And it really doesn't, I don't know if we necessarily need to have the report, but just internally, kind of looking back over the last 3 years, what did we do right? What could we improve on? Kind of where our strengths, weaknesses, opportunities, threats, that type of thing. Because if this happens again, God forbid, we were taking a lot of bullets while we were in the, in the fight. And now having it kind of pass us to a certain degree, maybe looking back on it and thinking, okay, if this happens, maybe we can do this, things that we can do to improve, right?
Some of that work is already ongoing. Our emergency preparedness coordinator did some of that work, the one that retired in January. He did some of that work, and now our new one is trying to do some work to wrap that up, but we will
Yeah.
share that with you.
Yeah.
So,
Yeah.
thank you.
I think there's some value there. And
Oh,
obviously,
without any doubt, because there are always lessons that we can learn from other spots. One of the reasons we're having staff make sure that everybody has some exposure to incident command system classes, is part of that, comes from that AAR.
Yeah.
So, yeah, thank you.
Good.
We will share that with you.
Awesome, thank you.
Anybody else? Nobody else? I've got a couple of comments here. As far as the opioid settlement fund for Hillsdale County and our committee, Commissioner Wiley is going to try and get a committee meeting here next week or the first week of June, and we'll be sending an invite out Alex and anybody else from the health agency that would want to come and present on that grant proposal. As far as the Medicaid redetermination, those individuals who lose Medicaid, after they receive notice that they're being removed from Medicaid, they need to act if they want to enroll in a marketplace plan. They've got 60 days after that notification from Medicaid that they're being removed from Medicaid. And they will have to submit the letter that they received from Medicaid indicating that they're being removed because as proof of that qualifying life event to enroll in a marketplace health plan.
Otherwise, they have to wait until open enrollment.
They have to wait until the open enrollment for coverage to begin January 1st.
Did you take some notes on that? I took some for you. We'll want a message on that. So, absolutely, we want to make sure that people know what they need
Right,
to do.
I mean, if they try and enroll online themselves, or if they use a navigator or an agent, they're going to have to submit that proof of that qualifying life event.
Thank you.
Yep. Moving forward, Dr. Luparello.
Good morning.
Good morning. Good morning. And Dr., it was 17 years ago that I think we met in person the first time.
It's the.
Because she's the one who grabbed, yes.
Oh, just to feel really old.
Because we're 6 at the time.
Just to
So
feel,
cute.
yeah. It was, I was just a child, yeah. So my report is in front of you, pretty similar to previous months. I finished my classes on Sunday, so that's kind of nice, my 2 classes for the last semester. And my practicum begins next semester, so kind of a research project with something at the end that you can kind of present to the public. So I'm gonna talk with Chris about potentially something that we need done here that isn't kind of in my realm. It's supposed to be a little outside of my normal job. So, I was running past ideas of the smoking cessation videos, the opioid thing is kind of being taken care of, I hope. So there's lots of things that we can kind of look at. So I'll probably do some project that hopefully will be of assistance here in the long run. And then this week has been lots of communication with area providers about H flu. That one pediatric death sparked a lot of issues with medications. How kids are getting treated if they go into the urgent care, are they getting the appropriate antibiotics, and unfortunately tuberculosis surveillance. So I feel like I have some good resources at the state level for tuberculosis surveillance, so we're working hard right now to kind of come up with a plan. And I am also heading to Three Rivers this afternoon to meet with Amy about our communicable disease programs and processes, and try to get a little better understanding of all of those with our, especially with our sexually transmitted infections. So I hope that that meeting is a good one this afternoon. I'm sure it will be. Any questions on my monthly report? Head into my Lyme disease, which actually makes me a little itchy after looking at all of the pictures online. I was like, I can't really bring pictures of ticks and spiders. And so my educational report kind of follows with Paul's. Oh, yes.
Mr. Matthew has a question.
Thank you, Mr. Chairman. Thank you,
Thank you.
Dr. Lupillo. I was in your hospital yesterday. Anyway, I just want to know how is your educational process coming?
Pretty well. I have, so in order to complete the program, I have this practicum, and then I have 2 more electives and my capstone project. So hopefully I can do the 2 electives and the capstone all of next year. So this summer's the practicum. So I'm closing in, it's getting there. My leadership class was actually, this last semester was probably the most time-consuming classes I had. It was a lot, but they were good. So, and I think I said last month, there was a lot of group work, but I ended up in one of the classes in a fantastic group. So I felt like I got really lucky because some of the other groups did not fare as well. So, and they were big presentations at the end, and I just couldn't find time to get together, and it was just a disaster for some of the groups. So online work is kind of interesting.
In regards to a program I know one of the classes was cultural nutrition. I know Michigan State University has, we currently have a position open in Hillsdale right now, but they have a food nutrition educator that they're trying to keep on duty in each of the counties to do food education. So I don't know if there's some collaborative work that we could do there with you on that, to help you with that.
That's the MSU Extension Health Educator, right? But, yeah.
Nutrition, yeah, I forget the exact title of it, but.
Now that caused me to interview someone from a certain background and do a whole presentation on the traditions, the culture, the food of that country, and how we look at that when people come here, and what if they live in a food desert and they can't even get those foods? How do you talk to them about things like obesity and diabetes when their diet consists of things from their original country that they brought over that we consider, somewhat unhealthy? Although when you look at most of the presentations, most of the other countries were doing much better than we were with obesity rates and nutritional rates. So I think we have some things to learn from other countries and diets. So, but it was very interesting. Anything else? So my education this month is on Lyme disease, since we were talking about vector surveillance and ticks, and Paul sending these college students out into the field. So we know Lyme disease is the most common vector-borne illness in the United States. And it comes from the bacterium Borrelia burgdorferi, and it is spread by black-legged ticks, especially this Ixodes pacificus around us. And it's really common in the upper Midwestern, Northeastern, and Mid-Atlantic states. And we all have heard of our little bullseye rash that we can get, the erythema migrans. So the incubation rate period is about 3 to 30 days. So once you get bit by a tick, you kind of have a month to see if you have any symptoms. And the important thing is to catch those symptoms early, especially this erythema migrans. So it looks like a bullseye rash. It's got kind of a red ring and another little red ring on the inside, and the tick bite is usually in the middle. And about 70 to 80% of people who acquire Lyme's disease will have that rash. So that's pretty high. So if you're looking for a rash, that's an important thing. And the early signs are fever, chills, lymph nodes that are swollen. And then later on, as you can see, you can get all sorts of very serious things from Lyme disease. So we've all heard of the arthritis that's kind of chronic and ongoing. But you can get meningitis, you can get cardiac problems. So pretty scary. And we want to make sure that we're treated early, because treatment is actually fairly effective, and it's just an antibiotic. It's long term, so usually several weeks of an antibiotic, but very easy treatment. So the testing for Lyme's disease, the CDC is kind of working on some newer things, because, so I'll give an example. My son several years ago came home from school with this giant lesion on the back of his calf, and they run around in the woods at lunchtime, and he said he got into class and he felt something in the back of his leg, so he kind of scratched it off, and it was this giant tick. I mean, it was huge. And so we watched him, and actually 2 days in, he had a little bullseye rash, and we went to his physician, who said, I'm not really even going to test him, because at that point in time, you probably haven't even established antibodies to end up positive on your test. But clearly, we need to treat him. So testing is a little bit delayed. A lot of people don't even do it, unless it's you're kind of extended in. So better to treat than wait for the positive test. The CDC also mentioned, I thought this was interesting, that there are about 30,000 reported cases of Lyme disease in the United States every year. However, when you look at surveillance and how many ticks there are and how many positive ticks there are, they think there's probably upwards like 476,000 people that actually acquire Lyme disease every year. So pretty prevalent disease, and my dad calls every night, so last night, and he usually says, what are you gonna do tomorrow? So I said, I want to have a board meeting, and we're talking about Lyme disease, and he's a hunter, so he said, make sure you tuck your pants into your boots, make sure you use some repellent with 0.5% carbapenem. And I said, well, Dad, you just look on the bottle. And he said, no, you want to make sure it's exactly that. And you can buy hunting and hiking clothing that have already been treated with certain repellents for ticks. So he was he was passing on that message,
I like that.
which I kind of laughed about. And we always did, so we were always hiking and walking, and because he hunts, we had this little entrance from our garage right into the laundry room. So you left your other clothes in there, or your bathrobe in there, and then you went into the laundry room, you took off all your clothes, they went in the washing machine, then you ran right upstairs, took a shower, a hot shower, and then you put on different clothes, and then your bathrobe went back into the next wash, so. And I'm sure you prevented a lot of tick-borne illness in our family. We were always out in the woods, so, important. So again, this is the time of the year to start watching. I thought the surveillance program that we have is pretty amazing, so.
Yeah, and just to piggyback on that, actually this week, one of our techs doing tick drags found a couple of black-legged ticks that are going to be sent in for testing. So very,
they're around.
definitely tick season, and so they're out there. So
What happens when we send those in, Paul? They just tell us what?
they'll test them and see if they're carrying
Bacteria.
the bacteria for Lyme disease.
And then we just have an idea of like the location. of
Right,
where they're-
right. And then, if they did come back positive, we would most likely do a press release. Say, hey, we've been doing surveillance. We got some of these ticks and they were positive. So just get the word out to the public that, the Lyme disease is important to be aware of, and we do have the bugs here in our county that are carrying it. So, any positives like that, we would definitely do a press release, get the word out to the public.
Any other questions for Dr. Lucarello? Yeah.
So Dr. Lucarello, I've had a friend that has kind of had long-term kind of symptoms from having Lyme disease. So what you're saying is if you don't catch it, it sounds like if you catch it quickly and you get on the antibiotic, it's fairly easy to mitigate.
Yeah.
But if you don't, there's some real long-term consequences.
Yeah, if you don't, it's very.
It's not like a
hard.
year later you can start taking these
Right,
antibiotics. and it's gonna
right,
help out.
very difficult. And then we end up treating symptoms.
Is that
If we
what
have
you're
arthritis, we treat that. If you have a facial palsy, we might look at that. But, yeah, if you don't put on antibiotics pretty quickly.
What is that window? Is that the 3 to 30 days?
Yeah, you'd like to do it early, in that early phase, yes, so within the month. So as soon as you see that rash, that's pretty indicative. You start feeling some aches and pains and have some lymph nodes that are swollen, you know that you were
Yeah.
in an area, so it's important to check.
Thank you. I appreciate it.
Any other questions? All right, moving forward, departmental reports. Up first this week is health education and promotion. Ellen.
Good morning. Health Ed and Promotion Department has been busy. We recently hired a new health educator, Isabella Styko. She started May 8th. I'm going to embarrass her real quick. She is actually right back there. We continue to monitor, update, and post relevant messaging through our social media platforms. Our Facebook, Instagram posts for the month of April included minorities and public health for the Minority Health Month, Health Equity and Inclusion, Child Abuse Awareness for Child Abuse Prevention Month, Safe Sleep, Public Health Week, STD Awareness Week, Volunteer Appreciation Week, and Earth Day. As Becky mentioned, we also put on the all-staff meeting April 21st. As far as feedback from staff goes, it went very well. So moving on to the 2023 Medicinal Marijuana Operations and Oversight Grant. We actually have a lot of pretty exciting stuff going on with this right now. One of the first objectives of the campaign that we wanted to get done was renew our contract for a second year with Branch Area Transit Authority. So we already have one design that's been on there for roughly 9 months now. We're going to renew that contract for another year. We're also going to design something similar for a second bus, and that'll be up later in the summer. The second objective that we wanted to do with this grant was work with Effect TV, which is a subset of Comcast. So we've worked with them to create a Lock It Up commercial that will run for 8 weeks from the beginning of July through the end of August. That'll be in Branch and St. Joseph counties. That will be shown on live TV and streaming services. The third objective that we wanted to get done for this grant was a billboard in Hillsdale County. Last year we had a heck of a time trying to lock down one of these billboards. We never ended up getting one, so we contacted them much earlier this year. We were able to secure one. That will be going up in the middle of June, and it'll run for 8 weeks as well. Lastly, for that grant, after reviewing our budget, we did not purchase any more of the lockable medication bags last year, but we do have enough this year to purchase a fairly small amount of them, but we will be getting some of those. Moving on to our community health worker program, during the month of April, our CHW Rachel Wall was very busy with some complicated cases that she already had. She also brought in 3 new clients. It was also announced at the end of April that the funds provided by this grant will remain available through May of 2024. So that's good news. We'll be able to, keep her on, hopefully at least through that time, with the idea of hopefully finding further funding to keep it going after that. Lastly, just some of the community events that we've been involved in recently. At least It's Not a Cigarette anti-vaping presentation on April 6th was given by my health educator Josh, who I believe is also behind me on one side somewhere. On April 12th, we attended the St. Joseph County Community Resource Roundtable. On April 13th, the Hillsdale County Senior Services Breakfast. Josh and our community health worker Rachel gave presentations there. Another anti-vaping presentation on April 20th. As I mentioned, the all-staff meeting was April 21st. We had a job fair here in Branch at the end of the month. And then May 13th, Rachel and I attended the St. Joseph County United Way Be Here Tomorrow suicide awareness event, which had an excellent turnout and was a very good event. So we were very happy to be a part of that. That is all I have. Any questions?
Those anti-vaping presentations, where were those at?
Perennial Park in Hillsdale, and there was one at Colon Schools for a parents program that was, it's a program that St. Joseph Community Schools does where parents get to come together after hours. Where was the other one located at? I didn't write it down. Oh, you're fine, you don't have to write it. They all run together because I've done so many of them, so.
Okay. All right, thanks, John.
Yep.
Another question, Alex. So on those commercials that we're looking at doing with live TV and streaming events, I don't watch much TV anymore. Pretty much everything I watch is on YouTube. So those will be some of the ads that'll pop up on my YouTube?
Yeah, correct. Well, it depends on the zip code, so we're only doing it in St. Joe and Branch. So zip codes that are within there, even if they spill over into Hillsdale or, but yeah, you potentially could.
Have we looked at any, doing any advertisement in movie theaters?
We have not, and that's basically because of budgeting. These commercials are a decent amount that take a pretty big chunk out of there. But I will remember that for future references because that's a good idea.
And on the billboard, do you know if it's sold a month after you bought it?
What's that?
Do you know if the billboard is sold the month after our 8 weeks?
I don't know how that works.
Okay. It's always a question that I would always ask in looking at billboard advertising is, what's going up after me? because if they don't have any, if I'm buying a month and they don't have anything planned at that point in time for the next month, it's a good chance I could only need to buy 1 month and I can maybe get 2 months free.
Right, yeah, okay, yeah, that, another good idea, thank you.
Sounds like it's been difficult for your event sponsor to begin with, so.
Yeah, last year I think the problem with it was a lot of the dispensaries and whatnot had taken up a large amount of the billboards, ironically. This year we beat them to it, so.
Get one side by side, so you can, an arrow pointing.
Yeah.
Lock this stuff up.
Yeah.
Alex, real quick, I'm on the Transportation Authority Board in St. Joseph County also, and Alan was telling us that you're thinking about doing signage in the buses in St. Joseph County, which is a great idea.
Correct.
I think it's a great idea.
Yeah, so he had informed me that you guys have these monitors that have been installed to where
Yeah.
we would present language on these monitors, but traditionally you guys have never done anything exterior as well, so I don't know if that was something that he was also gonna present, but yeah, utilizing those monitors in the bus would be
Inside the
amazing.
buses.
It would be amazing, because we
Yeah.
know you guys get a ton of flow, and,
Yeah.
you know, the transparency would be great for the
Yeah.
campaign,
Yeah.
so.
So it's a good idea, yeah, just kind of keep that in mind. I'm not sure where, I know Alan was still discussing it with you guys, sounds like Josh is on this, so.
Right.
Yep,
Very good, we appreciate it.
yep. Anything else?
Commissioner Matthew has a question.
Thank you, Mr. Chairman. Your report on page 9, paragraph 1 and 2, Commissioner Hoffmaster just touched on it. And what's the budget, please? Budget.
The budget.
Approximate budget.
Your budget amount.
Oh, for the marijuana grant?
Correct.
For which county?
Page 9, medical marijuana operations and oversight grant.
That varies by county.
Yeah,
And that money comes into the county and then is transferred from the county to the health department. I think
Correct.
Hills County is just over $10,000 a year.
Yeah, so it changes every year. Hillsdale this year, I believe, is just over 10,000. Branch is just under 20,000. St. Joe, I believe, has just over 7,000.
And so then we spend those dollars based on where they're located. So the vast majority of what happens is gonna be in Branch County because they've got $20,000 to spend. The least in St. Joe, and then Hillsdale falls in the middle. Those are dollars that are collected from medical marijuana cards. So card holders, they collect an extra fee that goes into this education fund.
Thank you, Board. Mr. Chairman, I have 2 more questions in relation to that. I know, Josh, you're thinking about 2 buses for Branch County. And what will happen, that bus is broken down and kept in 6 months in the shed? I know our fellow Commissioner House served on the Transportation Committee here later. Can you address that?
Ideally, I would agree that the buses shouldn't break down. But I suppose if that were to happen, they would have an obligation to let us know, you know, that that's happening, and we can go from there.
Well, the reason I'm asking is, we want to use that $20,000 such a way that citizens will, wherever you are focusing on. That's another, my third question and final, Mr. Chairman, is that whom you are reaching out to? People like me, old people, old citizens, or young, or middle-agers, or farther rural people,
So
or
the-
city? So we have to identify where that bus is going.
We don't actually know where the bus goes. I've seen it all over in different places around here. We don't have it targeting any specific population. The messaging itself is just lock it up. It's obviously targeted towards adults. The message on the buses itself is keep kids safe. So the messaging is for adults, obviously, that are buying recreational or medicinal marijuana. And the point is lock it up, keep it away from your kids. A lot of it looks like candy these days, so.
So awareness, public awareness.
Yep. Any other questions? No? Thank you, Alex.
Thank you.
Personal health and disease Prevention, Kelly.
Good morning. So I have got some updates for communicable disease, salmonella linked to live poultry. The CDC has been doing some extended investigations on cases, salmonella cases that have occurred with exposure to backyard poultry. So those are all underway, and we did have a couple of them where they reached out to us to see if we could do the extended questionnaire to try to get more information about this, the source of it and everything, because there have been 104 cases from 31 states and 11 of those in Michigan. So I believe we had 2 contacts for St. Joseph County that we tried to do extended investigation, and then 1 in Hillsdale County. So it just kind of digs into deeper questions on exposure, flock management practices, where they purchase their poultry, what kind of contact that they have with their poultry, and also information on hatcheries, so they can try to connect where the source of this is at. So it's pretty extensive. We already, do some salmonella investigation, but then doing the extended portion of it, is a 20-30 minute conversation with the client, and then also sometimes we dig in more to if they mention where they bought eggs from or where they bought their chickens from, then we sometimes contact the stores also to investigate further as to who are your suppliers and things like that. So it can be a very lengthy process. There's also, the CDC will post an investigation notice about this, which is on their website. So if you wanted to dig into more information as far as what they're finding from the investigation, that is publicly listed. And then I just put a couple of updates and links on here for you on just further information regarding some of those topics. Like there was an NDARD release on preventative measures with sale of poultry, and then some updates on avian influenza as well. I think the last detection was in March, so it's been a couple of months since we've had a recent detection. Let's see here, there was, Mpox cases are declining, but there was a recent cluster of Mpox identified in the Chicago area. So we decided, with summer events coming up, Pride, festivals, just people are gathering more as the weather gets nicer, to do a little bit more social media on this. So we worked with Health Ed, and they're doing some social media, and they put a banner on our website. I think it's the first banner on our website that they can click on to get more information, let people know that we do have vaccine available in our offices, and just preventative measures that people can take to make sure that they're social or having safe gatherings. Just a quick note on the COVID data tracker. So that's the MDHHS website had a COVID data tracker that was usually doing community levels, community transmission, and things like that. So they are taking away some of the surveillance measures that they had on there, and so it will display hospital admissions, deaths, and emergency department visits as primary surveillance now. So there are a lot of changes that are being made on some of those COVID data websites. Becky mentioned this already, but for COVID vaccines, we primarily, through the pandemic, because it was just such a large volume of vaccines that need to be provided to people, that the best practice of scheduling for us was through an online system on our website and on our COVID page. We've decided now that things have slowed down with vaccination, they have really simplified the vaccines now without having the monovalent. There's the bivalent vaccines, and we're not seeing as much demand for that. We are going to discontinue that, and then people will just schedule as is our normal or other vaccines that we have. They'll just schedule that via the phone call, which all of our nurses are very excited about, that it's getting to, somewhat normal practices as far as that. So it definitely did its job, but we needed it to do during the time. I can't even imagine if we didn't have that system, but it's good to kind of transition back into another practice for that. Not too many updates on WIC. Our staff did just attend the WIC conference. It was the past 2 days in Grand Rapids, I believe. And as I've mentioned before, with the public health emergency ending, we implemented our in-person a long time ago, so we have all categories available for in-person appointments. They'll definitely have to be back in person by August, because there's that extension after the emergency ends, little leeway time to get people all back in, but we're already good to go on that. And then our varnish program started, and our nurses have been providing applications to kids, so that is great. I'm glad we were able to get that preventative measure back in place. And then lastly, in children's special health care, we're still waiting, no further information on if they will do that age expansion from 20, I think it was 21 to 26. And then we did have a hearing and vision tech retire after 33 years, so we will be posting for that position. Happy to answer any questions that you have.
Any questions for Cal?
Thank you.
Thank you. Next up, environmental health. Paul.
Good
We've
morning,
talked
everyone.
About environmental health a lot already today.
Yes, we have. That's good. I like to have people educated on environmental health. That's what we do best. I actually have quite a few things to report on today. One of them, first one I wanted to talk about was just this week I got results back from a couple of more homes that were sampled near the Lucas landfill over in Hillsdale County. We had some sampling done earlier. They did have some detections of PFAS and 1,4-dioxane in one particular well. And so they expanded their sampling, and I'm happy to report that the 2 homes that were recently sampled both came back as non-detects for both PFAS and 1,4-dioxane. So that's really good news there. That area will be continued to be monitored. They may go further out and do more testing in the future. That's really up to the state. We just kind of assist them in giving us, they like to keep us in the loop so that we can have our input as far as what we feel might be the best way to proceed as far as sampling and maybe expanding the area. So I will keep you posted on that. This week, actually yesterday, I completed interviews for, we have 2 open positions in environmental health. One is for a 50-50 sanitarian position. We'll split time between food and general in our Hillsdale office, and then we have another type 2 water supply coordinator opening that we're wanting to fill, and we actually had some very good interviews, and I will be reaching out and doing some reference checks on a couple of the candidates, and if those go well, I hope to offer those positions to fill both of those positions. So that would be really good. We've been shorthanded here for a while, and love to have those positions filled. So things are moving forward with that. We already talked a little bit about our software system, and again, I just want to reiterate that that is going very, very well. We are very pleased with the way that is moving along, and we're excited to have that system up and running. Our target date is August 30th to have that go live, and I think we're very much on track to meet that requirement. So very excited about that. There's been a couple of pieces of legislation that have been proposed concerning a statewide sanitary code, and that legislation is a little concerning both for local health departments and for Eagle. The legislation has some issues in there that would create a lot of extra work. I'm most concerned about at the local health department level, but it also is going to create some issues for Eagle. One of the pieces of that legislation is proposing that every sewage system in the state be inspected at least once every 5 years. And before the meeting, Commissioner Matthew asked me if I could come up with a number as to how many sewage systems we have in all 3 counties. And I will work on that and see what I can come up with, Tom, but that's a huge number. And we don't have the current staff to be able to pull that off. That's a lot of septic systems across our 3 counties, and to have to you know, just to try to schedule all those and perform all those. The legislation also is requiring a very detailed, very sophisticated report on those, which includes not only looking at the septic system itself, but looking within inside the house and making sure all the piping is going into where the sewage system is. That's a big ask, and would require a ton of time. So our environmental health forum, which is MALIHA, has been having some very serious discussions about that. Eagle has been involved in those discussions, and I'm not sure. There have been a lot of proposals over the past years, and Becky can attest to this too, for a statewide sanitary code. This seems to come up periodically, and it's never has gained any traction, and I'm not sure if this one will either, but it's concerning to us, because it's really going to create a lot of extra work. We would have to hire a lot more people, and as I've been reporting here, it's really hard to find people right now, and that's another thing that they're putting in the legislation, is tightening up the requirements for sanitarians. So lots of concerns there, so I will keep you posted on that. Let's see, we talked just a little bit on our vector techs. They're up and running and going, and as I reported, we got a couple of black-legged ticks. Be interested to see if what the results of those come back as, and obviously if that comes back positive, we will get that out to the public. We have 2 techs that are currently working, one in St. Joe and one in Hillsdale, and we have one coming on board in Branch County, not next week, but the week after on that Monday. So, and we will be gearing up with our mosquito trappings. We're also going to not only be this year trapping for the Zika related mosquitoes, but in St. Joe County, we've identified one good site that would be viable for testing the mosquitoes that are related to triple E. And we have had some triple E cases in St. Joe County over the past couple of years. So I think that's important work too, that we get some surveillance going on there. The last thing that I wanted to talk about is this week I had a couple of meetings with the village of Constantine and with Eagle regarding a sewage overflow that happened on the sanitary sewer system. So the village of Constantine sends their sanitary sewage to 3 Rivers, to their sanitary sewage treatment plant. They have a line that runs through Gleason Road. I'm sure, Mr. Hoffmaster, you're familiar with that?
All about this from
Yes. So there was at least 4 or 5 breaks in that sewer line. It's a 10-inch main that happened, and a lot of sewage. They haven't been able to come up with an estimate, the number of gallons, but it's very significant. It's all been taken care of. The leaks have been stopped. It's been taken care of, but the damage has been done. There has, the sewage flowed across some properties there, some homeowners that were concerned. Some of that sewage may have also made its way to the wetlands, so Eagle is working on that. We are working with Eagle as well. We're going to do some bacterial sampling in some of those residential wells that were in that immediate area, just to make sure that we don't have any issues in the groundwater. One of the good things about that area is there's a lot of clay, which protects the groundwater, and also the wells that are in that area were very deep, like over 100 foot deep. So I'm not expecting that we're going to see any contamination in those wells, but I'd much rather be safe than sorry, so we're moving forward with that. So, with that, I think that's all I have for today. I'll be happy to answer any questions.
Okay, any questions for Paul?
Can I ask Paul on that
Sure.
last note? So I've had the homeowners that the property, that was affected reach out to me, ask questions about that. They're obviously very concerned. One of them sent me a video I'll show you after the meeting where you can literally see it just flowing out of this pipe onto their property and actually going into what it looks like one of the streams, which is pretty concerning, obviously.
I would like to see it, if you could forward that to me.
Yeah,
I would like to have
will.
that.
So I guess my question is, and they're obviously, and they're rightfully so, I mean, if it was my property, I'd be concerned.
Oh, absolutely.
So you said you're gonna do some bacterial samples of the wells? When is that kind of planned? Is that gonna be fairly soon?
Yes, probably next week.
Okay.
And Eagle is also going to be doing some soil sampling. You know, the sewage related to that particular incident is all regulated by Eagle. So our part in this is really kind of ancillary here. And you know, I offered to go out and take the samples. It just makes sense to collect the samples. But as far as the rest of the work involved with that, as far as soil sampling and looking into the waters, that's out of our. We don't have the manpower. We don't have the expertise to deal with that. So that's going to be all handled at the Eagle level, and they are very much their attention is very much on that site.
Okay, yeah. Because just like anybody, they just want to make sure they're being heard, you know, and that people
Absolutely.
are paying attention to them, and they're, you know, because this is a big deal.
Absolutely, and I know that the staff at Eagle has gotten a number of those calls as well, and have been working with those homeowners. So, yeah, it's definitely on their radar. It's high
Good.
on their priority list to get to the bottom of this. One of the things that I did find out, what actually caused the leak, is there was a lift station on. What road is that? Broadway, on Broadway, that somebody from the Three Rivers plant turned a valve off, thinking that that was an unused line. That was actually the incoming sewage from Constantine. So that sewage had nowhere to go, so it backed up, and that pressure caused the break in the line. So
They've been working on that on Broadway, that line coming
Yes.
into the plant, so I'm
Yeah.
sure there's something there. Well, from what I'm hearing from the homeowners, the property owners, is that this happens, you know, obviously to them more often than it should.
there has been a history of issues out there, and that is one of the things Eagle is really pushing Constantine on, is, you know, this is happening way too often. We got to come up with a permanent solution to this, because this is not acceptable.
Well, that's what the homeowners, or property owners are wanting.
Right.
Because it really is,
Right.
it's Constantine's pipe that is coming up to Three Rivers. They're responsible for the maintenance, they're responsible for the cost of that pipe. They need to do something so that these property owners don't get.
Absolutely.
Anybody living on property who would want sewage coming onto their property 2 or 3 times a year.
Absolutely, and that's what Eagle is really pushing with them. It's like, okay, you put a Band-Aid on this now, but there's a long-term problem going on here that you really need to address.
How many gallons were spilled, Paul?
They don't know, and that's one of the questions that Eagle has asked them, and they have an engineer that works for the city that was going to try to do some calculations based on how long it was running and the size of the pipe, but I don't have that information yet. That they hadn't calculated that out yet. It's very significant, though.
Yeah, very simple.
And you said it's happened before?
Pardon me?
It's happened before?
It has, not to that degree. There have been some breaks in that sewer line, but not nearly to this degree. As I said, there was at least 4 or 5 breaks this time, where in the past it's just been one here or there, so.
Commissioner Matthew?
Thank you, Mr. Chairman. My question is, when did this happen last, please?
This happened,
Approximately.
last week, it was a week before last, Tom, on a Friday. You
Any other questions for Paul? All right, moving forward, number 6, financial report. Approved payments. Oh, I'm sorry.
It's okay, I'm all geared up and then,
Oh, we're coming back to you later on, Laura.
there is quite a bit of Area Agency on Aging business this month, but thank you for the few minutes to offer you an update. We should all wave at Ashley. She's watching on YouTube right now, so good morning, Ashley.
Yeah, she told me last week that she would be here today.
Yeah, she was really wanting to, and she wasn't able to, based on how she was feeling this morning. So we said, better to be safe than sorry, stay at home. I wanted to introduce one of our audience members this morning. This is Wendy Nowicki. She is from Quincy, and she's our new elder abuse victim specialist for Branch County. If you would just take a couple minutes to give a background similar to the remarks you gave yesterday during the IDT.
Sure. So good morning, everybody.
Good morning.
I come with a background in VOCA. I was working as the VOCA 3 director for the Branch County Coalition Against Domestic and Sexual Assault. I was also their program director or coordinator for the sexual assault response team. So that's my background, as well as being an advocate for sexual assault there. Before that, I've done a lot of nonprofit work. I was on the board of directors and the executive board for the Capital Area Community Action Agency, as well as the chairperson for Policy Council up in Lansing area. And when I got to where I'd hit the limits of what I could do there, they ended up asking me to come on staff. So I've worked as an advocate, a family advocate up there for 10 years with families with Head Start. I've also worked as a parent facilitator with the Great Start Readiness programs in Ionia and Ingham County. I sit on the Fetal Alcohol Task Force for the state of Michigan. And I also spent about 10 years as a research attorney up in Isabella County. So that's my background. So I'm glad to be here. Thank you.
Thanks, Wendy. She's had quite a busy week. We had an interdisciplinary team yesterday in St. Joseph County. The tables in the courthouse were packed, so still being very well attended, great conversation, some updates from the state. One of our friends at the Elder Justice Coalition, which is a statewide group, was able to give some updates on legislation that's being proposed and worked on surrounding guardianships. So it's just been a really busy, fun week, and we're ecstatic to have Wendy's background and advocacy skills because, as you know, situations with vulnerable adults are just as sensitive, and her skills working with younger individuals and families will serve her well in this position. So we're glad to have her. There are currently 38, or we've served 38 participants year to date. 20 in Branch County and 18 over in St. Joe. So Tony, her co-worker, is very glad to have her to have the additional staff support. Older Michiganians Day was last Wednesday on the Capitol lawn, and we had a really decent turnout. Senator Lindsay was the only individual that was able to join us on the lawn. We had a very nice conversation with him. He listened quite well to some of our advocacy points related to waiting lists that we have in both counties and some of the needs with individuals that reside in long-term care facilities. We only have 2 long-term care ombudsmen that serve a 5-county region. And so one of the asks of the statewide group that put this event on is to try to bolster long-term care ombudsmen in the state of Michigan. We also want to increase the state budget for in-home services, which would be a nice plus as our special funding is coming to a sunset. There are more demands for services, so we experience waiting lists from time to time in both counties among all of our providers. So it was great conversation. We also did go up to the House building and met with both Representative Fink's staff and Representative Kara's staff. So had good conversations. They were in session, so they weren't able to come to the lawn, but their staffers did. It was good. It's still good to meet meet staff. The plan and the budgets related to the current fiscal year are before you later in the agenda. And I will offer those highlights, I guess, for the plan and those amendments when the time comes. Of note in other areas of work that we're embarking on is Senior Project Fresh is gearing up. We're waiting to get our final allotment of coupon books, but they're $5 coupons that older adults are eligible to receive. If they either go to our Commission on Aging offices who do the home delivered meals program, they'll get a stack of books. We'll keep some back because we do have some walk-ins and we do experience need with the community living program participants, but we have to wait until we get our final number before we provide those to our network providers. We do have a new market here in Branch County. I'm excited to welcome the Sunshine Gardens, I believe it is, here north of town, so that'll be good. And we are, our staff that's trained in the Medicare Medicaid Assistance Program, she's working really remarkably with individuals on some of their redetermination things. So I wanted to make sure that the board was aware that in every one of our offices we have trained staff that can help people navigate that redetermination and help understand why they were kicked off or no longer eligible and help them find other options for coverage. For older adults, you know, sometimes it is coupled with lower income and Social Security and Medicare and all these other things going on in their world. So we're really lucky to have Lisa and the meeting space to do so confidentially to meet with them. So that's about all I have in terms of updates. Any questions?
Any questions for Laura? Maybe we can get to some of those later on.
Yep.
Hearing none. Okay. Now, finance report. Teresa.
Yeah, I'm gonna apologize, I sound really bad. You have the bills before you. The unusual things that you will see in these bills is you'll see the Hedgerow software down payment was made for working on that project, and the RDK's asphalt sealant 50% down was also paid. Other than that, not much unusual in this bill cycle. And I'd be happy to answer any questions you have.
Any questions about the bills for the month of April? Yes, Tom.
The page one, Century Bank, Three Rivers, $2,000.
That would be, that's our contribution from the county, or from the health agency into the building maintenance fund. That's the requirement as part of the lease agreement with both St. Joseph County, and you'll notice Century Bank and Trust Hilton maintenance right above that. That's the same contribution amount. So that's what that $2,000 is.
If I may, it is a requirement in the Hillsdale lease. We made it our requirement.
Three Rivers, okay.
Yeah, good practice.
And
Good
That's
practice.
setting that money aside every month for that building maintenance. And if no other questions, I will entertain a motion to approve the bills for the month of April as presented. Motion by Commissioner Hoffmaster, second by Commissioner Matthews to approve the bills for the month of April. Any further discussion? Hearing none, all those in favor say aye. Aye. All those opposed, motion carried. Financial statements for the month end of April are before us as well. I know we heard Teresa does have that voice issue, so board members, do you have any questions about that financial statement? I know included in there is the report on each program as to whether they're over budget or on target for budget for the year to date so far. We'll maybe try and help Teresa save some of her voice for her presentation later.
Yeah, so you'll notice there are some things at the bottom there that all say 7, 15, 16, 17, 18, and 19 all say Eagle long-term monitoring. We need to get those labeled correctly. They are not labeled correctly right now. those are new RUs. The state is now requiring us to break out and track separately the amount it costs us to run the program for the campground inspections, the pools, the body art, the long-term monitoring, and the septage haulers. So those will be labeled correctly. And the reason that those are showing up the way they are is it's a brand new requirement mid-fiscal year. So we are in the process of making that changeover. So that'll be adjusted in this budget amendment that's coming up that you'll see next month. And then medical marijuana, you'll notice there's no budget amounts for those as well, because at the last budget amendment we did not know if we were getting that money. So you will see expenditures with no budget, but that's because we've been awarded that money. Overall, we are running under budget. We expect to be under budget because there's a significant amount of COVID money that we know we're not going to spend. So we're doing well. We're right where we expect to be, and we'll be bringing you a budget amendment in June.
Any other questions for Teresa? If not, I will entertain a motion to approve the financial statements for the month ending June 30th as presented.
So
Motion by Commissioner Hoffmeister, second by Commissioner Matthews to approve the financial statements for the end of April 2023 as presented. Any further discussion? Hearing none, all those in favor say aye. Aye. All those opposed, motion carries. Next, committee reports. Finance Committee approved minutes of the May 15th, 2023 Finance Committee meeting. Those were presented in our packet. Do we have a motion to approve those minutes?
So moved.
And support? I'll support.
Always supporting.
Motion by Commissioner Hoffmeister, second by Commissioner Leininger to approve the Finance Committee meeting minutes of April 15th, 2023. Any additions or corrections? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carries. Next, Program Policy and Appeals Committee meeting minutes from May 17th, 2023. Is there a motion to approve those minutes?
Yes, Mr. Chairman, yes.
In support? Motion by Commissioner Matthews, support by Commissioner Lanius to approve the May 17th, 2023 Program Policy and Appeals Committee meeting minutes. Any discussion or corrections? Commissioner?
Thank you, Mr. Chairman. Line 3 would like to add, I suggest to add with the Pledge of Allegiance to the flag of the United States, led by Director Haley Nichols. Thank you.
Okay, with that addition to the minutes, then. Any other additions or corrections? So motion to approve the minutes with the addition of the Pledge of Allegiance led by Director Kelly Nichols. Any further discussion? Hearing none, all those in favor of approving the Program Policy and Appeals Committee meeting minutes, say aye.
Aye.
All those opposed, motion carries. New business, item 8A, Area Agents and Aging, fiscal year 23, provider budget amendments. Do I have a motion to approve the provider budget amendments as presented?
So moved.
I second.
Motion by Commissioner Hoffmeister, second by Commissioner Matthews to approve the program, Area Agents and Aging provider budget amendments as presented. I know Director Sutter's here. If anybody has any questions for her regarding these changes, I will ask. These budget amendments were approved by and recommended for approval by the Finance Committee, correct?
Yep, we went over these with the director and everything's good.
Does anybody have any questions of Laura regarding the changes?
We never take them lightly, so be rest assured that all 22 line items are adhered to according to Hoyle and the Bureau and federal and state standards. Provider input was definitely incorporated to these amendments, as noted in the rationale. So we should be in even better shape after our finance meeting yesterday. You know, we're expecting things to look real good for the rest of the year. So.
Is Hoyle a state agency?
Say again?
Is Hoyle a state agency?
Yes, according to Hoyle, yes.
Any other questions? Hearing none, all those in favor of approving the Area Agency on Aging fiscal year 2023 provider budget amendment, say aye.
Aye.
All those opposed, motion carried. Letter B, Area Agency on Aging fiscal year 2024 annual implementation plan. Do I have a motion to approve the plan as presented?
Mr. Chairman,
Yes.
I make that motion.
Is there support?
Support.
Motion by Commissioner Matthews, support by Commissioner Hoffmaster to approve the 2024 Area Agency on Aging annual implementation plan. Is there any discussion regarding that plan or questions for Laura? And Commissioner Matthews, I do believe this was discussed and recommended for approval at the Program Policy and Appeals Committee meeting. Any questions for Laura on this? Or any highlights you want to mention, Laura, before we?
Other than the narrative for the public hearing was updated since the draft that's before you, there were no, and still have received no formal testimony relating to the plan, just positive comments and support from the advisory committee. I will say that the, you know, it went through advisory quite easily. They understood. This is basically a continuation of all the work that we did with the 3-year multi-year plan. And so the planning process each year just updates with new budget figures, especially for Commissioner Lanius, who's not been through a planning process quite yet. You know, we do this large 3-year plan, and we look at data and demographics and perform a community needs assessment, and then budget targets are, you know, adjusted based on what the community says it needs in terms of in-home services, transportation, meals, all of the array of services. Input is also given as to what should be funded by our budget, with these federal and state line items. And so this is just an update to that plan. It's still following all of the priorities that were outlined in the main plan, and we've also updated our progress with our program development objectives. And we are not anticipating any major increases or decreases in funding, so.
Any other questions? Hearing none, all those in favor of approving the fiscal year 24 annual implementation plan, say aye.
Aye.
All those opposed, motion carries. Letter C, fit testing equipment. We have a bid in front of us, I believe, from TSI Incorporated. Is there a motion to approve the bid as presented?
So moved.
I second Mr. Chairman.
Motion by Commissioner Hoffmaster, second by Commissioner Matthews to approve the bid from TSI as presented. This was discussed at the Finance Committee meeting as well.
Yes, and what we relayed to the Finance Committee is that one of the COVID grants will likely pick up the tab for this expenditure. However, if we end up not receiving approval to use COVID grant funds to pay for this, then at the end, towards the end of the fiscal year, if we have unspent funds, we will use those instead of the COVID grant to make the purchase. If either of those don't work out, we will not make the purchase at all.
No, what is fit testing?
So it is a way to ensure that a mask is properly fit to protect the wearer from any contamination in their environment. So we use them during normal life for work with TB patients and other communicable diseases like that.
Okay. Any other questions? Hearing none, all those in favor of the motion, say aye.
Aye.
All those opposed, motion carries. Letter D, annual report. Do we have a motion to approve the annual report as presented?
I second that.
Motion by Commissioner Hou, second by Commissioner Matthews to approve the annual report as presented. And Commissioner Matthews, this was also discussed at the Program Policy and Appeals Committee meeting. Does anybody have any questions regarding the annual report as presented for the health officer?
Be a better picture of me,
The only comment I'll make, and I didn't say this at the meeting, committee meeting, is I'm glad to see that we've returned to using pictures without masks. So, much better to see those smiles than to see that hidden behind his mask. So. Any other comments? Hearing none, all those in favor say aye.
Aye.
All those opposed, motion carried. That concludes our new business. We are now back to that time where the public has an opportunity to speak to the agency. I don't think we have any. Before we get to the final item of adjournment, I will just say thank you for allowing me that opportunity to reflect and remember those who gave all. 55 years ago today, our family was gathering for the visitation service of my uncle, who was killed in action in Vietnam on May 9th. So, Memorial Day is a very symbolic remembrance in our family. That brings us to adjourning. Do we have a motion to adjourn?
Somebody. I'll support that.
Motion by Commissioner Lania, second by Commissioner House to adjourn. All those in